there is a great attention to the hair in India. I have noticed. Uh, and there are problems with the hair. I mean, not just ordinary problems, but other things come in. How does one properly treat the hair?
See, again, hair is again a part of the individual. So instead of treating the problem in the hair area, it is always better to treat the person who has developed this. So, like it can be baldness, it can be a patchy alopecia, it can be graying of hair. In some people, hair do not grow. In some females, we have seen the main complaint is the hair gets split in two ends or three ends. So, there are so many issues, but most of them are related to general health of the person. It never is a local problem. So it is always better to treat the person internally on the basis of totality to overcome. But at the same time, there would be like graying of hair. So with the age, graying will be there. It will be like a normal health. Based on that, we can't say. But we see like at the age of even 15 years, the children are having gray hair. That is definitely abnormal. On an average, after 40 years of age, the graying starts, not before the age of 40. Same is the case with baldness. People start getting bald, not necessarily, but especially males. If they have some inheritance, they get bald, but after 40. But if they are getting prematurely bald or prematurely gray hair, we should treat them, but based on the totality.
Now, I have seen um, women color their hair, color parts of their hair, have their hair split on the ends. All these are cosmetic treatments. What do you feel about that?
See, applying hair dye is not advised from health point of view, because these chemical dyes, they definitely have adverse reaction on the skin as well as in the whole being. We have seen miserable sequelae of applying dye and getting allergic to it, and it took many months to overcome that sort of allergy. So in general, we don't advise applying dye to hair. When patients come to us insisting upon themselves applying dye, we treat it as a totality, as if the person has complex. So when we treat the person in totality, that complex goes off. So person is okay with gray hair. That should be done. But in general, we don't advise coloring. It's an indicator of some complex, inferiority complex.
It could also be a statement. Um, a young person wants to look different from others. We see
Quite
this with
possible.
the boys all
Yes.
the time. Dozens
They
of
make
types of
red. Yes,
haircuts.
yes. They get red hair or some different
yes.
type of color.
Yes.
That's what it indicates their mental state than the health of the hair.
Okay.
But there are cases where the hair get tangled easily, then the hair loss is there, hair become brittle. So these are again indicators of some stigma in the general health, and based on that we have to treat.
How big a part does stress play?
It's a major thing.
It's a major.
Stress is a major thing.
Okay.